Keep quiet.
Hello. Who should keep quiet? The kids are.
Sorry.
Can you keep quiet? Again.
Okay, Doc, you have the floor.
Amayo.
All right, Baba. All right, Doc, you have the floor.
Okay, so can you see my slide or I need to share it again?
You have to share it again.
Okay. Okay, so electrical injury. So as for electrical injury, there are two types. The low voltage one, so from the house, maybe the socket, the damaged socket, or the high voltage one from either high tension lines or lightning. So these days, it's advisable that when you're putting up buildings, you should have a lightning outlet so that it carries the lightning. You have a lightning rod so that it can transmit the lightning. Otherwise, it can strike and cause electrical injury. Now, two things usually happen when you have electrical injury. It causes burns, and then it also causes ventricular fibrillation, which is a situation whereby it causes the ventricles to contract abnormally. And so that disrupts the blood circulation, because if the ventricles are contracting abnormally, it means that the blood flow or the pumping activity of the heart is disrupted, so it doesn't flow as it should. Okay, so usually the one from the house is usually the alternating current, so it causes muscular contractions. So because it's alternating, the current goes in one direction and then it alternates, and that causes the muscular contraction. So for example, if you have a live wire, you step on it, or that electrocution that occurs with a faulty socket, that's what can happen. And sometimes it can cause spasms, and that is what causes the people to stiffen such that they cannot move. So once you feel the shock, ideally you should be able to move away from the site. But if it is very severe, it can cause the muscles to go into spasms. So you'll not be able to contract and relax like you should. It goes into spasms, like you are stiff. And so in that instance, somebody will have to move you away to safety. Otherwise, you can die from that. Oh, I always say that my slides end too suddenly. Next time, next time I'll put summary there so that we know. Usually when you are projecting, you can see that. Yeah, usually when you project, you can see that, okay, you're about to finish. But the way it is here, I won't see. Then the next thing I know, it's gone.
You don't need 400 slides. We don't need 400 slides. The ones you have is okay. We don't need 400 and 200 slides.
You ask your questions.
Okay, so any question for Doc? Let's hear them.
So Doc, does it mean we are not doing the online examination again?
No, I'm not doing online exams. I'll give you assignments.
Okay.
I'll give you assignments, and then when school reopens, we'll have the exam.
Hey, madam, but we are not on vacation. We are still in school.
She gave a condition.
As in when you start going to school, when school starts, I'm basing this on the fact that the school, or at least according to the HOD, he doesn't really have a plan.
Hey.
Yes, he doesn't have a plan. So the basis of my decision is from the president's address yesterday, it seems that schools might reopen soon. As in, schools might be allowed to start having classes soon. And so if we've been able to cover most of the material, then when school starts, we'll just have the exam, the written exam, and it will be easy to just have maybe 2 lecture halls for the exam. You just space out and then you write. And for me, for pathology, it will be multiple choice questions.
What
But
about the clinical method?
But for clinical methods, it will be the same format as you had last semester.
Madam.
So same exams.
Not the same question.
They didn't say the same questions.
The same format.
Doc is saying that.
But you bombarded us with questions.
Guys, listen, no. Guys, listen. Initially,
You have, I think, section A, B, and C.
Hey.
okay,
But
so
you did very well in the exam. It's not as if it was difficult.
yeah,
Madam, it was difficult. It was plenty.
okay, Doc. For the benefit of those who didn't start the lecture, guys, please listen. If I'm getting you right, you were saying that from what the president said, it's assumed that the month of June will be for the final years, and then if July is opened for everybody, that is when we'll write the exam.
Yes.
Okay, but if it's not, then it means that you will use the assignments you give us, either the 5 or 3 for the exams.
Yes.
We'll grade that as 100%.
Yes.
Okay, so guys, you heard the conditions.
Yep.
We
hear
hear conditions. I will talk to the president.
Okay,
Talk to the president.
Okay, please. It's okay. Back to pathology. Let's ask our questions. Madam Esther, you have a question. Please ask. Your hand is up.
Yeah.
Madam Esther, please unmute your microphone and ask your question.
Yeah, my question is with the electrical injury. I saw a electrician. He died on the pole. He was trying to fix something, but the second death,
Oh, Doc, you're laughing.
He rather fell down, and it was as if there was smoke around his body, but he survived. So I just, I didn't really know how the whole thing happened. So if you could just help me small.
You didn't know how what happened?
The first one, he died on the electrical pole. But the second incident that I saw.
So if he falls down, it means that he's been removed from the source of the electricity.
Okay.
Okay.
And so you are more likely to survive if you are detached from it. But usually what happens is that when you have the electrical shock, your muscles go into spasms. So you become stiff and you cannot move away. You cannot move yourself away. So what would happen is that if he becomes stiff and he stays there, then the current will keep going through him. He'll keep having the fibrillation and then the abnormal heart rhythm, and that is what can cause the death. But if you have a situation where you move away, then you are likely to truncate that continuous electrical circuit and then can be sick.
That's why they use the warmer to hit the people from electrical.
Yeah, because they become stiff and then they are there. They cannot contract and move away.
So, ma'am, what account for the? So, ma'am, what account for the moving out?
What account for what?
Foster, you said what account
for the person sticking with the pool or for the person moving out from the pool? What happens?
The person just explained it right now.
No, I'm talking in terms of the person sticking there.
The
Why
person
is it that?
what?
Why is it that that instance he can't move from there? And the
He
other
gets
type,
stuck
why
to
is it
it.
that the other yes?
The muscles go into spasms.
So he can't move from there.
Yes.
No.
So why is it that the other aspect, that one moves from there?
So if he fell, the person fell. So
Person
look
fell.
at this scenario. If you are standing on a ladder and your body stiffens, once it stiffens, you could fall off the ladder because you don't have the muscle contraction to hold grip on the ladder. So you could fall. Are you
Yeah,
okay?
Are you okay?
Yes.
Yes, ma'am.
Hostess network is not good. That's why he was finding it difficult to understand the thing.
So he probably didn't hear.
Yes, the network is not good. They should use better phones.
Hey, Asemo.
Madam.
Yes.
Madam, please spare the pathology of smoking you gave us. You said it causes constriction of the blood vessels. But then there is this myth that smokers are always good at sex. How is that? So is it just a myth or something?
It's his opinion.
This is something that people go on and on and on about.
What do they smoke that make them good at sex?
Madam, codeine and all those things.
In particular.
No, madam.
Did you
like
say
this
they smoke codeine?
And codeine. They
But they don't smoke codeine. Codeine is a cough.
I didn't say you smoke codeine. I'm only saying yes. I'm only using that one, like the smoking aspect, the weed aspect.
Who is speaking?
The weed.
So what I know about weed is that when you smoke it alters your brain. It gives you what we call a high, and so that might be what is responsible for their sexual performance.
Madam, but is weed medically good for the body?
So medical marijuana, yes. There is medical marijuana, but it's not the smoked one. It's not the one you are smoking.
No, madam, if you say that's not the one I'm smoking, it's like you're directing it to me.
No, I'm not talking about it is not the smoking.
Madam, you have said it well. The one he smokes.
It's not
that one is Aveno. That one is Aveno.
Hello. Let me explain.
It's not the smoking that is therapeutic. It is the cannabis oil that is extracted from it. That is what is therapeutic. It helps with so many things, epilepsy, so many medical conditions. But it is not when you smoke it, because when you smoke it, you change the metabolism, and the active ingredient is not that medically helpful.
Okay, helpful. Now, madam, what if you chew it or use it for tea?
Pardon?
What if you chew or use it for tea?
Yeah, so those ones are better.
Okay. Madam, so does that mean that for the cancer patients who have issues with pain, that means they wouldn't be allowed to smoke it, but then they'll take it through other forms?
Yes, I have a friend who deals in cannabis oil, and it's one of the things that it helps with is cancer and pain.
Madam, may I chew it or use it for tea? It's very productive. It's very good.
Yeah, it's.
Christian, you have a question.
Doc, please, good evening. Yeah, my question is more of gynecology, but it's in line with shock. During sexual intercourse, there had been incidents. It's either the man goes into shock, collapses, or the lady goes into shock. Given account of these things, we can somehow clinically come at a conclusion to what would cause a man to go into shock during sex. But women who are lying in wait, women who are relaxed, lying down, what will surmount to them going into shock after long periods of sex.
Madam,
The
today they
gynecologist.
Madam is not a gynecologist. She's a pediatric.
I really don't know what would cause them to go into shock, but maybe it's emotional. Because I know that extreme emotion can also cause shock by causing peripheral vasodilatation. So maybe from that angle, but physiologically, I don't know.
Okay.
So I'm thinking
what of Madam?
Emotional.
Maybe they
Okay,
are
madam.
hypertensive already.
Okay. Madam Esther,
Thank you, madam.
Madam, what of
guys,
Yeah.
hold on. Madam Esther's hand is up.
like continuous?
Madam
Can
Esther.
it cause that shock as well?
Okay, seems she's now aware. Madam Esther, your hand is up. Or you are done with your question. Okay. Any other question?
Any other
Madam,
question?
Madam,
Yes.
you are talking about this thing, the wheat, the oil. You are talking about the importance and what it does. Can you highlight it again?
Hey boy.
Not.
Madam, I chew it or use it to do tea.
I mean,
If you like, you can throw it in fire.
You can use for cancer, for epilepsy, especially for cancer, especially for the pain management. But
okay,
it's not licensed for use in Ghana. So
yeah,
all those people who are using it, they are using it on the quiet.
okay. Madam, I learned it's also
Ibrahim.
good for
Ibrahim.
the wheat.
Yes,
cooking.
Yes, Nat, please hold on. Ibrahim has a question. Ibrahim, please ask.
Okay, I want to ask a question like in terms of ventricular fibrillation, is it advisable to use the defibrillator in this situation?
Yes, if the patient, so let's say you are called to the scene, there's a shock, the patient has fallen down. You check the pulse and you realize there's no pulse. You can use the defibrillator.
Madam, at what voltage are we supposed to?
So that is clinical medicine. This is pathology. The voltage depends on whether it's a shockable rhythm or not. Okay, but usually you use 20.
20 joules.
Yes, but like I said, it depends on the particular situation. Are you okay?
Yes, madam.
Okay. Madam Esther, your hand is up again.
No, Apple. It was the first
It's the
one.
case.
Okay. Let me lower it for you.
No,
okay.
It was the first one.
All right, that's fine. Okay, N2S, please. I don't know who you are. Please identify yourself and ask your question. Unmute your microphone, please. N2S, please unmute your microphone and ask your question.
Wada.
Let me see. Okay.
Any other question?
No, madam.
No, madam.
All right. So call it a day.
Okay.
Okay, madam.
Okay, madam.
Tomorrow we'll start with nutritional diseases.
Okay.
Okay.
Okay. Have a good.
All right, Doc. Have a good night.
You too, madam.
Thank you. Bye. Thank you. Bye-bye.
Bye.
I don't know. Hey.
But I had no con the wheat in. I just a monum this year.
Not.
That's brain be why.
Not the real.
Nick, Ubenum Sobolo, Uber Sobolo, the enemy.
If I bring me, baby.
Boy, Nick, me what tough, you know, better tough, you know.
There be all tough in quite a bit.
Nick, come about them.
Kola, eka out of the bank, I'm not so baloney, sir. Oh, tie.
Oh, they are not about them. You're not about them.
Actually, what Benz ma? What to Benz? Our point at you be say, I call him in our class. We tough in a one board. What?
Also, Becca, who now can we as a Kola Sana would it tough with the other?
Yeah, me count.
Or the tough in it to the beans, more than I'm tell you.
Where the Yes.
I just want you to give me the how I'll prepare tea. I'm so much interested in that one.
Okay.